Hi friends, welcome back to Coffee with Ravi. Today my post is about food poisoning and foodborne infections. It's also that time of the year. We're having cookouts, we're eating outside, and I think it's good to bring attention to this topic. Every year we have about 16 to 18 million cases in the US of food poisoning and foodborne infections. And I think I want to classify this into three broad groups. And I'm going to try to approach this in different ways. One, by symptoms that are predominantly nausea and vomiting, by symptoms that are just bloody diarrhea or watery diarrhea. And I'm also going to go about it by different areas of the colon, and I'm going to try to separate it out by means of different bacteria, viruses, and protozoa. So when we look at the first group, when we eat bad food, essentially we're getting these foodborne illnesses through bad food or food that's not been preserved or food that's been contaminated. When one has nausea and vomiting, most of the time right after eating, within a few hours after eating, there's three big groups. One is Staph aureus. It's a staphylococcus is an infection, and it forms toxins. So the toxin is already formed in the food. We've ingested it. It's mostly protein-rich foods, sometimes, milk, eggs, things like that. And the bacteria has already worked on the food. The second one is Bacillus cereus. That, if you eat fried, it's usually been described with fried rice. 3 to 12 hours. Anything between 3 to 12 hours after eating, we start throwing up, maybe some kind of fried rice, something that was sitting out, or something that was maybe somehow had preformed toxin to it. This group then doesn't usually have diarrhea associated with it. The other piece with this is sometimes norovirus infections are highly contagious. They can cause nausea, vomiting. You can actually get symptoms with as low a dose as even 10 small viruses, and it can shed for up to 5 days and up to 4, till 5 days or even up to 4 weeks. So highly contagious. We hear about norovirus outbreaks in cruise ships and things like that. So keep that in mind. But if you're throwing up, then it's mostly a preformed toxin. Think about what you ate within the last hour to up to 12 hours. And usually these are self-limited and they pass. When we start approaching the other group that causes diarrhea, remember I talked about two things. One, a diarrhea that can be watery, and a diarrhea that can be bloody. So those are the two groups that we need to kind of be concerned about when we have foodborne infections. We've covered, of course, the toxin-based ones, but we're now talking about diarrhea. Now, when we talk about diarrhea, which is loose watery stool or frequency of stool, different from what you had before. There's, of course, more technical definitions of this. If one has diarrhea and it's less than 2 weeks and it passes, it's mostly infectious. Sometimes if it persists from about 14 to 28 days, it's probably infectious. But as it starts getting more than 4 weeks, then we start thinking about other forms of diarrhea, that is ulcerative colitis or collagenous colitis or something, celiac or some other problem that's happening. But now within the context of what we are talking about, we're mostly focused on acute diarrhea, and that's mostly infectious. When we have watery diarrhea as opposed to bloody diarrhea, usually it's these viruses. There's it's a bacteria called Clostridia perfringens. It can be in meat, poultry, and gravy. There's a bacteria called ETEC. There's a protozoal infection called Cyclospora associated with raspberries, food, water. Cryptosporidial outbreaks we hear about. These are small infections. These are protozoa. Giardiasis also is a protozoal infection, and you can get it in daycare outbreaks. You can get it in camping, non-potable water. So make sure that if you're going camping, you have these high efficiency filters that are available at Shields or what have you, so that you're protecting the water supply. When it comes to bloody diarrhea, that's a totally different subset. It's Salmonella, Shigella, Campylobacter, and this is something you could have consumed 2 to 5 days. Usually with meat, poultry, and produce. It can be occasionally with, of course, vegetable contamination too. There is a particular toxin called Shiga toxin producing E. coli The incubation period for that can be up to a week. You get it by raw fruits, vegetables, ground beef, and there's an infection called Yersinia, which is from undercooked pork. It can cause bloody diarrhea with loose bowel movements. Switching gears, we had talked about this. We had talked about our gut is divided into three big portions: the upper portion, which is the stomach; the middle portion, which is the small bowel; the lower portion, which is the colon. The small intestine, which is in between, or the small bowel, can be sometimes prone to protozoal or parasitic infections like Giardia, Cryptosporidia, Cyclospora, Entamoeba, Dientamoeba, Strongyloides. All of these are both parasitic and protozoal infections that we get by eating bad food. There's blood tests for it. The best test for it is a stool test, and then sometimes you need to do stool stains, and sometimes you need to kind of put it together with outbreaks that have occurred, because sometimes multiple people get sick, and that's a good way to kind of be a detective and try to piece it together. There are some small bowel viruses, and this is the most common mechanism. What happens is that the virus affects the small bowel. There's lots of inflammation there. There's enzymes that are required for digestion that are lost during this infection. And this can be pretty severe in sometimes. And really, what we need to do is make sure that there's a lot of hydration. Make sure we focus on the prevention piece of it. And one thing that I try to remind ourselves is that alcohol, hand gels that we use don't really prevent the spread of viruses or even actually C. diff. So hand washing in the way that it's really taught, for 20 to 30 seconds, and really scrubbing is the only way that you could actually prevent the spread of these viruses, especially if you're not sure somebody is sick. Wash hands, but don't use alcohol gel wipes. So that's small bowel. Then as the small bowel links up to the colon, and I have a diagram in here where the ileum and the colon join up, there's bacteria such as Campylobacter, Salmonella, Shigella, Yersinia, Pseudomonas, and Listeria, etc., that can affect that joint area. There's parasites such as Trichuriasis, Entamoeba, Schistosomiasis. These parasitic infections are less common in our part of the world, but can be in other parts of the world. So just for your information, there's a virus called CMV that we see sometimes in people who have immune suppression. For example, if they've had organ transplantation or if they have other illnesses, sometimes CMV can be a problem, or in the setting of inflammatory bowel disease such as ulcerative colitis, but that's the area that is generally associated with. And I have sort of another small bowel kind of infections that, rotavirus, norovirus, some of these are all affecting the small bowel. So essentially think about small bowel, think about the ileocolonic area that can be joined. So different areas are affected by different bacteria and viruses and protozoa. Giardia is common. We see sometimes these outbreaks. You can get a stool test, but the stool antigen is a good way rather than just the stool antigen is a special test. We do that. There are a few people who have low blood levels of gamma globulin. So it's a antibody that's in the blood that fights off this infection. But sometimes there's a group of patients that will have low gamma globulins, and they can get recurrent sinusitis, recurrent Giardia infection. So if somebody's gotten Giardia a couple of times, I would encourage a thought about, hey, is anybody predisposed to hypogammaglobulinemia? Another little tidbit about traveler's diarrhea. Traveler's diarrhea is usually a bacterial diarrhea. It can be any of these protozoa too, like Giardia. When we travel outside the country to areas where the water supply is not as protected, think about exposure within the last 1 to 3. Usually it's 1 to 3 days, but you can think about it up to 3 days. If it's mild, we treat with an antibiotic called rifaximin. If it is severe, we think about it with cipro and azithromycin. And if there's bloody diarrhea, we of course would treat with azithromycin. So think about traveler's diarrhea. So in summary, I think protecting and keeping a good food chain and storing food in a sanitary manner under good conditions will prevent it. Sometimes we cannot help it if there's outbreaks that come in even before that in the food chain. Washing hands if somebody is sick is a better way than alcohol prep pads. And if diarrhea lasts and that is severe, think about rehydration, but think about seeking medical attention, because some of these now, there are tests that can actually test for all of these in the stool sample. So that testing technology has become much better. And very, very rarely do you need antibiotics. Antibiotics are really not the go-to and for this kind of infectious diarrhea, but there may be a few exceptions to that rule. So thank you. I think if you have questions, as always, reach out to me, and I look forward to our next meeting.